But actually, you should choose what you really like to do because it will be with you forever.
Forever.
You
Yeah.
can change after that, but now in the bachelor degree, you need to choose one. Yeah, one track.
One track that you are more happy.
And then when you finish, you can choose your own work, what you like to do. Maybe you would not be a pharmacist.
Welcome to PharmaTalk Podcast, brought to you by pharmacy students. I'm Nisha.
And I am Om.
And today we're going to talk a very important topic of us.
Yes, about examination.
Yeah. Actually, I don't used to this topic that much because we are just in the fourth year.
Yes.
And especially for pharmacy students in first year or second year, they don't know about this.
Yes. We don't talk about this in
Normally.
early year. Yes.
Yeah. Today we must have special guest.
Yes.
Yeah.
Special guest will give us and you the information about a license examination.
So today is very honored for us to let them here to talk with us. So who is our guest today?
Today our guest Assist Professor Dr. Phญ.นทพร and Assistant Professor Dr. ณัฐพร ชัยพิชิต
Yay!
Sorry.
Thank you so much
Thank you
for
so
being
much.
here.
Thank you for inviting us.
Yeah, can you please introduce yourself a bit?
Okay. Assistant Professor Dr. Phญ.นทพร or you can call me Jing or Dr. Jing as you are our students. They
Yes.
maybe a little bit taking the respect for us. Yeah, you can call me Dr. Jing. Yes.
And I am Assistant Professor Dr. ณัฐพร ชัยพิชิต and you can call me Dr. Oil, just a short name.
Can you tell me a little bit about yourself?
I'm
Dr.
graduated from Pharmacy Chiang Mai University as my bachelor degree and my master degree. And after that, I got my PhD from Free University Berlin in Berlin, Germany.
Wow, that's very cool.
That's very good
Yeah.
because Germany have it's about a medicinal chemistry.
Right?
Mostly in like technology.
Technology.
Yeah.
I'm graduated from Chiang Mai University also, and it's a Pharm B program. So I studied for 5 years, and then I realized that I still need to practice more because I love to do the practice in clinical pharmacy. So at that time, I chose to study in master degree in clinical pharmacy in Content University. And then before I graduated from my master degree, my professor asked me to, pursue for my PhD program. So I studied there and then finished my PhD at Content University.
Wow.
Wow.
More than study, what are your hobbies?
I think I like sports. Quite a lot of sports, like swimming, basketball. But when getting older, and I would like to try the horse riding. And then I studied and settle for work. I practice horse riding.
Is that hard to do the horse riding? I've heard
for
a lot.
me, it's not that hard, but you need to practice both of your strength and your conscious. I mean, it's used both, not the brain, but the conscious, and you can take a concentration better.
I'm so scared
Also.
to horse. กลัวมันดีด
Oh, กลัวดีดแล้วตก
Yeah, you can practice like a step by step.
What about Dr. Oil?
For me, usually in my free time, I love to watch movies and also listen to the music. And I usually go to yoga class, but then everything like stopped after I have my baby. So this time around, my hobby is to take her to her piano class and the ballet class or something like that. Yeah.
Why did you decide to become a lecturer?
Well, just like I said, actually I want to be a practitioner in the hospital. But then after you graduate from the PhD and then you have like the focused mind that I like to teach and I like to, develop myself every day, improving and also to practice other people to be a better person. So that's why I choose to be in the lecturer career.
And what about Dr. Jing?
Yeah, for me, honestly, when I finished my bachelor degree, I worked in the hospital, quite a big hospital. Yeah, the สวนดอก hospital near our faculty. Yeah, for in my in my year, they have to work for the government at least 2 years before you can go to choose your free words.
It's kind of like if say in Thai is ใช้ทุน right?
Yes, like that. Yeah, but actually it's not really the scholar, but every pharmacist have to work at least 2 years in the government. Yeah, and then after that, I went to the U.S. for around 2 to 3 months with my mother. And then it started what I would like to do like that. Yeah, around 2 to 3 months, I met some professor from the Chiang Mai University, and they are my lecturer here in pharmacy school too. Then after that, yeah, okay, when I come back, take a master degree, and also I got first year PhD in Chiang Mai University too. And they convinced me to go study abroad. Then that's why I went to the German.
So you love study.
Actually, it's not really love, but that's maybe somebody's when you talk with another one and you see more worldwide, and then you can decide more easier or what you want to do, where you want to go like that.
Excuse me. Would you mind if I ask you that you happy when you work in hospital?
Yes, I can say it's a kind of work that I'm happy because we can help a lot of people. Yeah, we can use all of your what you studied in actually in clinical, in the pharmacy in clinical care. Yeah, but mostly in the big hospital, you have just doing like a routine job. Then sometimes when you take 1 year, 2 years, maybe it's a bit boring, but whatever, you can help a lot of people. Yeah.
And you head up to pharmaceutical science?
Yeah, because I liked experiment. Yeah.
You like it?
Yeah, I like more than SOAP, the SOAP. I like more than the
I don't like it
pharmacotherapy.
too.
Yeah, so that's why I choose the pharmaceutical science.
I don't like it, but I choose care.
Because
I don't like experiment.
Oh, I see.
Actually, I choose pharmaceutical science when I in the bachelor degrees because I don't like a therapy.
That's why I say the same reason with me.
Everybody don't like it.
I think that's the deepest reason for all of us. But actually, you should choose what you really like to do because it will be with you forever.
Forever.
Yeah, no chance after that. But now in the bachelor degree, you need to choose one. Yeah, one track.
One track that you are more happy.
And then when you finish, you can choose your own work, what you like to do. Maybe you will not be a pharmacist.
Maybe open the bakery shop.
Yes.
I want to ask more about the study experience. Like, what inspired you when you're in grade 12 that you want to be in the faculty of pharmacy?
Honestly, I want to be a dentist. Yeah, and then in the healthcare professional, be doctor or dentist or the pharmacist. And then from the dentist, I choose to be a pharmacist because I think they still have a work that can help people for sickness, get them better. So that's why I choose to be a pharmacist. And then when I study here, and then you will grow in your mind that you want to be a better pharmacist to learn more about the medicine and to give the medicine to the patient properly. So that's why it makes me happy about that.
Yeah, so we asked about the dentist, but I want to be a dentist or a doctor, but actually I think it's not necessarily what we need to be, and especially the dentist need, I think in my thought, it's need like artist, something about the very small thing, skill to do, but I'm not. I can't. Then my family, many people in my family are also in the health science. Yeah, and especially some also pharmacists. Then that's why the pharmacy faculty is one of 3 which I choose when I have taken the examination. Yeah.
Wow. So we are going to the main topic
Yes.
of this episode. So can I ask Dr. Jing about the pharmacy license examination? So what is pharmacy license examination?
Yeah, this examination is for the pharmacy student who almost finished. I said almost finished because now they have 2 times examinations for they to make sure every pharmacist have the same standard when they finish and work in Thai.
Especially Thai.
Yeah, this one is for especially licensed for Thai pharmacists.
I think the pharmacy license exam is typical in every country, like in the US or the UK. Yeah, but in Thailand, we have the exam to make sure that every pharmacist are qualified to work in the hospital or in the industrial.
Yeah, so is that separated between pharmaceutical science and pharmaceutical care to take this exam?
Okay, so we have like two times of the exam. So the first one is called the core competency. So the core competency is for the students who have finished their 4th year. So all of them have the same standard, like knowledge about the medicine, the products, and also this common skill to interview or to counseling the patients. So this one is similar to other students. And then after you choose the track to be whether in the pharmaceutical care or pharmaceutical science, then in the 6th year, before going to the 6th year, you will have another test which will be separate. Like for the pharm care students, it will be like the PC1 and the PC2, and pharmaceutical science will be IP1 and IP2. Yeah. For the core competency, there are 2 separate exams. So the first one is the CC1. It's be MCQ exam. So in multiple choice, around
2 half days.
2 half days.
Yeah, and most of the MCQ ask you the basic knowledge like pharmacology or some simple disease like eye disorder or GI disorder or something like more not too complex. Yeah, and then,
But mix in every subject.
Yeah, in every subject, and they also have the list of the disease that you have to prepare before the test. Yeah, and also in the science, you have to take the test about how to prepare the medicine and also the medical chemistry. Yeah.
So the percentage of the knowledge that you have to prepare it's maybe roughly about for the pharmaceutical care maybe it's 50%, and pharmaceutical science or technology is about 30 to 40%, and the rest is about like pharmacognosy or also for the law.
But this is in the multiple choice.
Yeah, from multiple choice.
Do we have the exam like OSPE or in that time?
So actually, for the 4th year, we have 3 days of the exam, 2 for the MCQ and 1 for the OSPE. So normally we took the OSPE on Friday, and then Saturday and Sunday we MCQ.
Oh.
Now we call CC1 is the former called MCQ, it's a multiple choice, and now the OSPE we call the CC2. But maybe it's a little bit confused that you will take CC2 on Friday and you take CC1 on Saturday and Sunday.
How do you prepare for the test?
For me, I am the first pharmacy student who had to take this license exam.
Wow.
Yeah. But at that time, it's a little bit different because I study, at that time, it's just 5 years study and you get a pharmacy license. But before that,
They don't have any exam.
they don't have any exam, but in each faculty, each university, they have the comprehensive exam to test their own student before they finish to be a pharmacist, and then they will get a license. But for me and my friends, we have to prepare. We don't have the comprehensive exam, but we use that examination just like to practice by ourselves. And then the first time we prepare the OSPE, we have to ask many lecturers to teach us again how can it be, because all the lecturer there will not really have an idea what about it like that. Yeah, just about 1 or 2 years they prepare the examination or they prepare the exam, but not really doing as the formally. Yes, then it's a little bit scary maybe. But we have to prepare. It's the same as you have everybody to have to prepare for the examination.
Yeah. So she is the first year, and then for me, we know that from our seniors that there will be like this exam. So my friends in the same year, we divide all the content that what we have to do the test. So we have each group who will be review the topics about this one disease or other topics that relate to the exam. So when we study, then we have like a small lecture class from our friends. I'm one of the lecturer from my friends. Yeah. So you will get better if you be like the teacher or someone who provide the knowledge to your friend. So it's kind of a big responsibility to do that. So when you help your friends and do the mock exam for the MCQ and also the OSPE, then that's a good start for you to prepare. And then after our mock exam, we go out and practice our clerkship. And then we have like 1 or 2 months to prepare for the exam. For me, I like to study alone, so I have some lecture notes that I got and I review them before the exam again.
I always tell the students that you need to practice in this lab. You have the whole semester, 2 semester. Yeah, 1 and 2 semesters you have to practice.
Yeah,
And the checklist is already in the last page of your lab direction already. Yeah, and that's why you need to practice.
When I was the first year, I don't care.
I understand. That's why after that, in 4th year and 5th year, they think about me. That's why I have to.
I know that why you're
every
very
time.
strict when in the laboratory.
Yeah, I think I am.
Yeah, but I think it's very good because I can remember that you shouldn't take the pipette like that.
Yeah.
So I remember until now. Yeah.
How you carry the cylinder, how you
Yes.
measure it like that. Yeah.
And what about Dr. Oil? How long?
How long do you recommend us to prepare?
I understand that during the study time you have so many assignments, but when you do the assignments, actually, especially in pharmacotherapy or other classes, you can have time to do it by yourself, and then you can recognize them and understand them, and then you take notes, and then before the exam, like 1 or 2 months, I think that's will be the most part that you should be concentrate on them. Yeah.
What about straightforward during prepare for the examination? How to manage it?
Yeah, for the stress.
Yes, how to manage.
It's quite difficult, but I think we have to think it's about we have to pass it as normal as every exam that you take it every semester. But this time it's just like you should manage it well, like because it's everything you studied in maybe 4 years or even 6 years. Yeah, but the MCQ or CC1, CC2, it's just 4 years that you already studied, and it's core competency. It's not everything. It's just which is the core. Yeah. Or actually, you can see like an OSPE, you can see the core competency skill in the book. It's already there, and then you just practice, and you already practice for the OSPE. And then for pharmaceutical care, which disease or which system they already list for you, and what is the core, and then you can ask lecturer in the pharmaceutical care to just like
Make sure
have
that it's
you.
the right one.
Yeah, it's the core competency. It's not everything. I know, I understand. The lecturer won't give you anything in the broad spectrum that you know and you can apply in your real life, in your occupation. But when the first CC1, it's just only the core competency. You just manage it well. When you manage it well, and then you will relieve your stress.
Okay, we need to focus only core competency.
Yeah, for the CC1 and CC2.
Yeah.
What about Dr. Oil?
Me, I like music. So during my study, I always listen to the music, and also I change the coffee shop. Yeah, I study in the coffee shop. So I go out, and some others say that it's too, distraction. But when I put on my, headphone and reading in my books, I can study there. And then when I get bored, I can look at other people's. So that can, relieve your stress. But then at the time, you have to be focused, like 2 or 3 days or a week before the exam. That's when you have to be like more focused in your room. Yeah. Or if you, if too stressful, you can talk to other people. If not your friend, you can ask the lecturer or others that can help you. To cope with the stress. We have like the hotline for that if you are too stressful. Yeah.
And there's look like different ways to the way to relax. For me, I cannot listen to the music or I cannot studying in the coffee shop anymore. So maybe it's a different generation.
So, do you want to suggest anything about the second round of examination in 6th year?
You mean IP and PC?
Yes, IP and PC.
For me, I can talk about the IP because like industrial pharmacy, they have 2 days. 2 days. The first one is IP1 and IP2. IP1 it's look like an MCQ for your. It's not a core competency, but it's the advanced things that related in industrial. Yeah, like a PD or QA or QC.
Instrument.
Yeah, it's not only the instrument, it's just like a system.
Oh.
The system about the industry. Yeah, it's like look the overview, and especially for industry, like an MCQ. And then the other one, the IP2, it's just like case presentation. You just pick one case when you got from the pharmacy training in your 6th year. And then you got one, I recommend, which is the topic that you like most, and then you think you know it most, the best you know it. You just pick that one and prepare for the presentation, what you get from your training. And then it's just your presentation. That means you are the best one, you know what you're talking about. And don't worry about it. The examiner will ask just around what you present, or maybe something related to what you pick up. That is not really so stressed because you are the best one and you choose the best thing. You feel it.
And how much time that I can prepare before this presentation?
You can choose whatever the whole 6 year that you have the training, but just which one you chose. When you choose your topic, and then you can prepare for your presentation. Yeah, it's quite a different for PC, I think.
Yeah. So PC, we have PC1 and PC2. The PC1 is the MCQ. So the disease will be more complex. Like someone who has allergy to some the first line of the medicine, so you have to know what is the second line to treat the patients. Or someone who have like adverse drug reaction from the first medicine, you have to go for other medicine for them. And also for the PC2, we have like a case for you to prepare. So it will be like 5 pharmaco system that you have to choose. If you want to be infectious disease or CVD, cardiovascular disease or something like that, then you have to start, they will have like a case for you to prepare 1 week. So you can, talk with your friends or solve the problem with yourself. Or if anything that, you're not sure, you can ask any professor. So they can, clarify you, but not directly answer to you. So if you already study and you have some question, you can ask them. So that's why you can prepare yourself for the PC2. So during the exam, you have time to, talk about what you have found for drug-related problems from the patients, and then to assess what becomes the problems to that patients, what is the etiology, the cause of the disease, or the risk factor that you found from their patient profiles, and then to assess whether they have proper management for them. Yeah, and then you have a special question to get more score from that. And the last part will be a consultation with the physician and also with the patients. So to prepare for the consultation, you can start practice from now how to talk understandable for other people with the physician also and to the patients. Yeah.
Oh, it sounds
Sounds like skill in pharmacotherapy.
Yeah, that's a lot. So the soap notes that you do it every time, it's skills. So you have to practice more and more. Yeah, so when you're in the clerkship for the 6th year, all the year round, you can practice all of them.
How you pick up your
Topics.
topic, yeah.
They
Just
already
random.
have the list. They have the list of the topics, and then they will let the students to choose which topic they would like to do the soap notes. Yeah, so
You
you
choose
can
by your
choose.
own.
Yeah, they can choose by their own.
And
Yeah.
then they have 7 days to
7
prepare.
days to prepare.
Okay,
Yeah.
you still have time to prepare.
Yeah.
And you choose the topic that you think
You are
best.
more comfortable to do. Yeah.
So we have to prepare now, today.
Yes, we have to prepare now.
Just collect it. Just collect it a little by little. And then when you finish the first year, and then you at least 50% confidential like that. Yeah.
So what do you think about the pharmacy license? How important of this examination or of this license?
So just like we mentioned before, the pharmacy license exam is to make sure that all the pharmacists are qualified to take care of the patients. So this one is so important because if you fail, but it doesn't mean that you're not a good pharmacist. You can be a good pharmacist, but it's just you might not able to make the right decision for the exam. That's all. You can practice more, and then you will get the chance to pass the exam. Yeah, don't be too serious.
I understand that every pharmacy student thought it's the most important for your life to be a pharmacist. I think it's right. You need to pass it because you will get the license. Otherwise, you cannot be the full duty of pharmacist. But you still have the knowledge. Everything you studied. But yeah, as I said, maybe it's not what you can remember in the examination. Maybe next time it will be your time. You have to pass. Yeah, just that. But everything you learned, you already know it. But just prepare. And it's very important for be calm when you are in the examination. Just be calm and just take time for thinking about what you have learned or what you have reviewed already. Yeah.
Especially in OSP. For me, it's
yes.
very short time, and as we say in the last episode that we talk about OSP a bit, that we have very short time, and we see our teacher, and I forgot everything.
When I see our teacher face, oh, my knowledge is gone. I can't say anything. Always smiling.
Yeah, even we are prepare a lot, but in that time sometimes we don't have we have too much, too nervous.
Too nervous.
Nervous.
I think all the teachers want to smile to you to make you more relaxed. So, can you tell us how to make you more relaxed in that room?
Yeah.
Because all of us try to be relaxed to you and try to make you calm down.
Our feeling when you're smiling, I feel I have a mistake.
Yeah.
I have some
Okay.
mistake. Okay.
Because if you at first you're not smile, and after that you smile, I feel like, yeah, I do
What
something wrong.
happened? Like
Yeah, but if you smile at the first and smile all the time, I think, oh, okay, it's good.
Okay.
Just a little bit for the CC or the OSPE is the normally the short one, the normal one. I mean, it's 4 minutes, and if the long one, it's 8 minutes. And 8 minutes, it's mostly it's a practice for making like a solution or the semi-solid thing, like a levigating. Yeah, or together with weighing and levigating, something like that. But for the tip, it's first you go to your station and waiting for the signal to start, right? Or even you just go to the station, you just read the instruction first. Just be calm, read the instruction, and get what they ask. Just that point, what they ask or what they telling you to do. Yeah.
Yeah, I think the first thing when you go to the station, just introduce yourself and must remember that to read what you have to do in that station. They have the instruction there. You just read and then you can do it directly as the instruction. So you get enough time to complete your 4 minutes test.
And I want to ask some question that if that question I cannot answer, so how like do you have any experience that you got this question but you don't know how to solve them? So what tips that you will give to us?
What about for the pharmaceutical care?
For the pharmaceutical
Just introduce
Depends on the
ourselves.
checklist, right?
Just smiling.
Maybe introduce ourselves and do some checklists that like you do that. Introduce.
Yeah. So for the interview station, at least you have to complete all the formal part that you have to do, like who is the patient, any allergy of something or any symptoms today and other symptoms or the previous treatment that you've got. So all this interview section should be complete. You've already got this one. And the last part, it will be like to solving their problems. It will be some small part. So the first part can, you should collect all of them.
Normally they have the checklist, like 10 points or something like this. And you just do it. The first one, maybe a calculation, how many tablets you have to use for this one. But if you cannot calculate it, just make it like 30 seconds. But if you cannot, maybe nervous or something, you can just tell the lecturer or the examiner that you don't know. And the examiner will tell you maybe it's not the right answer, but just like 2 tablets, 3 tablets, and then you just make it. Don't take too long time for just only the first. If you don't know or you cannot, you just tell. And then you can get the other score for the other checklist. Maybe like grounding, put it or measuring something, and then you can get every checklist after that. Yeah.
Okay, good.
But you don't try to start over again because you lost the last checklist allowed the last one. You just do it step by step as you can do. Just that.
Wow, that's very good tip.
Good tip because I have
Just do it. Go over it.
I have experience about calculation. I cannot calculate it.
Maybe it's just 2 or 3 marks maximum, just that. But the other 7 or maybe other 10 like that. 10 marks, you can get it a long way when you prepared when you do it.
Do you have anything to tell pharmacy students that watching us here?
For me, as a student of the pharmacy student, I have a happy time to study with my friends, and if you have like stressful or something like that, you can go to other lecturer or someone to help you to cope with that problems. And just try not to be alone, because when you study, you have time to be with your friends, and they will be a good friend until you graduate, until you've grown up. So a good friend will be in your university right now.
Wow.
Yeah.
And what about you, Dr. Jing?
Yeah, I understand because I deal with the student from the first year until the 5th years. Yeah, and I always tell my student that it will not be easier or looser when you go up the 2nd year or 3rd year. It's maybe more serious or much more information you get it every year that you go up, but it's just that you prepare for your career and just relax and happy to deal with it. Yeah. Otherwise, if you have some problem, you just ask maybe your lecturer or your advisor. Or if you don't want to ask your lecturer, advisor, your friends, your family, yeah, just try to be happy. I mean, because if you chose it, but whatever, if you don't choose, you can change to be what you want to go. Yeah. But just must be happy to live with it. Yeah, just that. And when you take this examination, or every examination, especially for license exams, I can tell you you are a student and you know much more than I or even the lecturer, because the lecturer already like a sharpening to directly in their field.
Yeah.
And when you're licensed now, you are the best and you know much more than even your lecturer.
Yeah.
You know everything. you know
Yeah.
everything.
That's right.
But honestly, if I have to take this exam, I will not pass. Just that. Yeah, don't worry. Just you are the best now. When you finish the 4th year and 6th year, you are ready for your license exam already.
Much more than that, some people are in high school students that decide which faculty. So can you invite them or tell them anything about pharmacy faculty?
Yeah, in my field, in pharmaceutical science, I can say you don't need to be just only the medicine. I mean, the medicine, it's like, I think everybody thought that pharmacies, it's still about the medicine that like used in the hospital or in the drugstore, like that. But actually for me, in my field or my research field, I do, medicine for like a drug delivery, how to eat the drug and then you will get well. Yeah, you've finished the disease already. But after on the medicine, it's just like cosmetics or cosmeceuticals. It's also in this pharmacy field, or use the basic in pharmacy to be the other science, the other one. Yeah, it's quite wide field that you can reach it now. Yeah.
What about you?
So many people know that the pharmacies work in the drugstores or in the hospital or in the industrial, but and they can make a lot of money. But more than that, they have to be responsible for people's life. So before we can do that, you have to study, practice in for the products of the medicine, and also the knowledge about the disease and how to use them properly to each patient. So if you are, a kind person who want to help other people and get more sleep than the doctors or the nurse, you are more welcome to be a pharmacist. Yeah.
Oh.
So the last one, could you share up us and all pharmacy students who prepare for this examination?
Yeah, I would like to tell you, as I told, you are already feel anything from your first years until 4th or whatever who in the 6 years. And you prepare just a little bit, manage it, everything. Yeah. And we, the lecturer, all the lecturer and also your friends, your family will be support you in everything you want. I mean, also in another university, you can go to your lecturer or your friends, and everybody will cheer up you and support you in everything you want. Yeah, and especially our students, we are willing to help you in everything to make you pass this stressful examination. Yeah.
Thank you.
I hope you finish everything, pass everybody. Yeah, for your license.
But right now we don't have any questions because we are not prepared yet. Yeah.
So Dr. Jing told you all of the share of things. So one more thing that I want to tell you is about the time management. So this is so important when you're in the the crisis of the study life. I know many things that you can do like now in social networks or watching the series and all of them. I mean, maybe you have to pause in a little bit so you have time to study and you more focused about the exam. So when you are ready and prepared, then you will pass it. I make sure of that.
Thank you.
Thank you so
I
much.
try to pause it. Okay.
Of course, we are going
Don't
to
pause
okay.
it so often.
So that's all today, and it's very nice to talk to our
Yes.
professor, today. And thank you so much for being here. And we are going to the next session
Don't forget to like.
Share.
And subscribe.
to our PSAT channel, and see you again in PharmaTalk Podcast at 19th October. Bye bye.
Bye.